Well, welcome back, everyone. Here's an interesting statistic. 100 million people in our country suffer from chronic pain. That's quite an astonishing number when you think about it. Now, many of these people, in order to cope with this pain, manage this pain, are prescribed opiate drugs. The category, I think, is opiates, right?
Opioids.
Opioids. And opiates in that classification there. And they include some of the ones that we hear about frequently, like Oxycontin and hydrocodone and stuff like that. Well, we found a professional in the field who deals in pain treatment and management, Dr. Jeffrey Fudin. So welcome, Jeff.
Thank you.
Very nice to have you here. Before we went on air, Jeff and I had just an amazing conversation about this. So I'm going to try to go back and just hit on some of the key points that we spoke about earlier.
Sure.
In the way I set that up, a lot of people suffer from chronic pain. You specialize in the treatment and management of this. What do you see?
I see mostly chronic low back pain. I see patients of all ages, from early 20s to, gosh, over 100. Mostly chronic low back pain. It travels down the spine, sometimes to the legs, so we get some numbness and tingling. I see some neck pain, and probably diabetic neuropathy. Those are the most common pain syndromes that I see.
Right. Headaches fall in there somewhere?
We do have some headache patients. The ones that I have are usually very, very difficult patients because they've already been seen by a neurologist.
Whoa.
And they basically were unable to treat them with standard medication therapy or injections. So those are the patients I see with headaches.
Well, you know, we live in a drug culture. Western medicine really relies on drugs a lot, unlike Eastern medicine. And opiates are, you know, as soon as you hear the word Oxycontin or hydrocodone, those kinds of words, you think to yourself, addiction, addicted, whatever. Not necessarily true, and there's a positive side to this if it's diagnosed properly, managed properly, treated right.
That's absolutely true.
Okay, so what do you look for there? What do you do?
Well, we use risk tools that have been basically validated. They're questionnaires, and we ask our patients to fill these out. It helps us to determine what their probability is for risk of abuse or misuse of these drugs. We have them sign a consent for long-term opioid therapy so that they understand what the risks are and the benefits. We explain the difference between addiction, tolerance, and dependence so that they don't feel that they're an addict, that we're doing something bad or it's the end of their life, that they understand that this is the correct category of drugs for them. But there's a lot that goes on. And we also ask them to do baseline urine screens, and then we do random urine screens to make sure that everything is cool and we know what's going on, and to keep the patients honest as well.
Yes, I'm glad you. Well, you know, to that last point, I wanted to ask you, we talked to police departments about this. There's people lie on the forms. They don't tell you the truth.
That is true. And so we do use two forms, an opioid abuse tool and an opioid misuse tool. And sometimes if the patient answers the question one way and then they try to lie on the other form, we kind of got them. So we use that, but it's important to use these urine screens as well, because sometimes patients, well, they'll tell you something, and then you do a urine screen and say, well, you know what, you have marijuana in your urine. On the other hand, from a provider's perspective, they need to know how to interpret those urine screens, because a lot of medications can cause false positive PCP, which is hallucinogen, or marijuana, false positive for various, or false negatives. So you need to know how to interpret the screens as well.
You know, I think there's a real sensitivity, by the way, if you're a doctor, to even prescribing drugs like this because of their insurance risks and all of these things. And something you said to me before we went on air that really struck me. The doc was saying that, you know, people sometimes don't want to face the fact that they may be addicted or might not know they're addicted, and in a urine sample or a urine test, you'd be able to say to someone, hey, I've spotted something here.
Correct. So we may have a patient, let's say it's on Oxycontin, so you suggest, all right, and their urine screen comes back negative for that drug, but positive for heroin metabolites or morphine. Well, we've got a problem there.
Yes.
So, you know, I try and get doctors to look at the positive side of this, that, you know what, we've identified a problem, let's get this patient help. Let's send them to a counselor. If opiates are really the only safe option for them in terms of medical reasons, then maybe shorter leash. do more urine screens, bring them in, do blood testing, make sure that they do follow-up appointments with their behavioral health folks, instead of throwing them out. Because if they do come back positive for a drug that was not prescribed and you throw them at a clinic, these are patients, legitimate patients, that started out legitimate, that maybe will end up on the street buying heroin because nobody wants to prescribe their prescription opiate.
Right, and you were saying before we went on air again that there's a clear path that shows that patients who are seeking relief from pain, if they're not welcomed at the clinic and there isn't a prescribed process to go through, they wind up on the streets.
That is true. In fact, I would say that the worst state for that is Florida, because Florida had these what we call pill mills for many, many years, and they were closed down. And so imagine now you've got a state with geriatric patients now who have legitimate pain needs, and they've tightened the controls up so much in Florida that pharmacies are actually limited to how much drug they can purchase. So patients can get the prescriptions, and then they drive around to maybe 10 different pharmacies, and they get to a pharmacy, and the pharmacist says, yes, we can fill out a prescription, takes down their address, and finds out they're from a different zip code. So in the state of Florida, they say, oh no, if you're from a different zip code, you can't have the drug. So some of these elderly patients are ending up on the street shooting up heroin. And it's happening in other states too now.
Wow, and considering the fact that, you know, it's common knowledge now that we've got a heroin problem. It's cheap and all this other stuff. And, you know, it just pains me because I think to myself, it's such, you talk about addiction. This heroin, it destroys lives, you know. So
oh, yeah.
It is. Now, Doc, just one last thing. What should someone do? They're experiencing the kind of pain that you're talking about, low back pain. There might be headaches. There might be some other kind of chronic pain. What should they do?
Well, if they have pain, then obviously they need to see their doctor, especially if it's a new pain. If their pain is increased, it's not a wise idea to increase their dose if they're on these drugs without first checking with the doctor. So it's smarter for a patient to call me up and say, my pain is increased, can I increase my dose? Instead of doing that and then apologizing later. Because that's a problem. So the doctor's like, you know, you're taking extra drugs. And it's interesting that so many patients think nothing of doubling their dose, taking extra tablets, drinking alcohol, taking some Valium, taking a drug from another person, and they come in, I say, first of all, do you realize that it's a felony to take a drug from somebody else, even if they give it to you? Do you realize you could have died? They don't get it.
They don't recognize it. Boy, what great advice. Jeff, thank you very much for coming in. Look, 100 million people suffer from some kind of chronic pain. And I think we all know someone who may have faced some of these issues themselves. This is great advice to take heed. So thank you again for coming in.
You're welcome.
To see this interview again, you can head to our website, looktvonline.com.